Dr. John Burns with the Dallas Plastic Surgery Institute says that when it comes to breast augmentation, most of his patients fit into two categories.
One would be primary breast augmentation patients who have never fully developed appropriate sized breasts for their frame. The second type of patients are women who have had breasts in the past, but with childbirth and breastfeeding, they've lost a lot of the volume.
Dr. Burns says after breastfeeding, some women have smaller breasts than they did before the pregnancy. They're often told that a breast lift is the only way to restore their youthful appearance.
I really reserve the breast lift or mastopexy for those cases where the implant really cannot overcome the effect of gravity. In most cases, you can recreate what they've lost with just an implant and not have to do a breast lift. If a breast lift is necessary, of course, I don't have a problem with that, but in most cases, that's not necessary. This patient is a patient that has 3 kids, has lost a lot of breast volume, would like to be restored to a full C cup, small D cup that she was during her breastfeeding months. And that was easily accomplished by placing an implant under the muscle. There was small incision underneath the breast crease, which restored the volume and also set the nipple back on the proper place on the breast. She was told by other physicians that she absolutely would need a breast lift, and I feel like that for her we were able to accomplish what she wanted with just the implant.
When it comes to choosing the right size of implants, Dr. Burns says for the most part, patients have 3 options.
You can have a low profile, moderate profile, or high profile implant. And what that means is that for that base, a patient could have limited amount of fluid, moderate or high amount of fluid, which would give an increase in cup size from 1 to 3 cup sizes. And in my practice, most of the time, patients will choose the moderate profile. With breast augmentation, as a physician, it is extremely important to me to listen first to the patient, to find out exactly what the patient wants. And anytime you want to talk to a patient about size, it's very critical to point out what implant would look natural on their body. And what we want is for a patient to have a breast implant where the breast size is very natural for that person's body, not too big and not too small. Every procedure needs to be tailored specifically for that patient.